Good morning to each and everyone. This is Mohaimin T. Petron, the leader of Group 1. For today's report, we are going to talk about 5 nursing theories. These theories are Levine's conservation model, Peplau's theory of interpersonal relations, Orlando's theory of deliberate nursing process, Travel B's human-to-human relationship model of nursing, and Hall's core, care, cure theory of nursing. Before anything else, let's begin with Myra Estrin Levine's The Conservation Model. Myra Estrin Levine was born in Chicago, Illinois, in the year of 1920. She died on March 20, 1996 at the age of 75. She was the oldest of the 3 children. She had 1 sister and 1 brother. History and background. Levine developed an interest in nursing because her father was frequently ill and required nursing care on many occasions. Levine graduated from the Cook County School of Nursing in 1994. She obtained her Bachelor of Science in Nursing from the University of Chicago in 1949. Following her graduation, Levine worked as a private duty nurse, as a civilian nurse for the U.S. Army. After earning an Master of Science in Nursing at Wayne State University, year 1962, she taught nursing at many different institutions, such as University of Illinois at Chicago and Tel Aviv University in Israel. She authored 77 published articles which included an introduction to clinical nursing with multiple publication years 1969, 1973, and 1989. She also received an honorary doctorate from Loyola University in 1992. Theoretical sources. Levine learned historical viewpoints of diseases and learned that the way people think about disease changed over time. Belland directed Levine's attention to numerous authors who became influential in her thinking. Levine was proud that Rogers edited her first publication. She also acknowledged Nightingale's contribution to her thinking about the guardian activity of observation used by nurses to save lives and increase health and comfort. Concepts and definitions. Levine's conservation model is based on 3 major concepts and assumptions, namely conservation, adaptation, and wholeness. That is promoting adaptation and maintaining wholeness using the principles of conservation. Conservation is the keeping together of the life system. To keep together means one hand, to maintain a proper balance between active nursing interventions coupled with patient participation, and on the other hand, the safe limits of the patient's ability to participate. The primary focus of conservation is keeping together the wholeness of an individual. The nurse accomplishes the goals of the model through the 4 conservation principles, namely conservation of energy, conservation of structural integrity, conservation of personal integrity, and conservation of social integrity. Conservation of energy refers to balancing energy input and output to avoid excessive fatigue. It includes adequate rest, nutrition, and exercise. Conservation of structural integrity refers to maintaining or restoring the structure of the body, preventing physical breakdown and promoting healing. Conservation of personal integrity recognizes the individual as one who strives for recognition, respect, self-awareness, selfhood, and self-determination. And lastly, the conservation of social integrity. An individual is recognized as one who has family and friends, community, workplace and school, religion, personal choices, political system, cultural and ethnic heritage, and a nation. Adaptation is achieved through the frugal, economic, contained, and controlled use of environmental resources by the individual in his or her best interest. Adaptation is critical for conserving wholeness in the midst of constant environmental changes. Last concept is wholeness. It exists when the interactions or constant adaptations to the environment permit the assurance of integrity. It has 2 factors. First is person. It is a holistic being who constantly strives to preserve wholeness and integrity, and one who is sentient, thinking, future-oriented, and past-aware. The wholeness of the individual demands that the individual life has meaning, only in the context of social life. The second factor of wholesomeness is environment. It completes the wholeness of the individual. The individual has both an internal and external environment. The internal environment combines the physiological and pathophysiological aspects of the individual and is constantly challenged by the external environment. The internal environment also is the integration of bodily functions that resembles homeostasis rather than homeostasis and is subject to challenges of the external environment, which always are a form of energy. Homeostasis is a state of energy sparing that also provides the necessary baselines for a multitude of synchronized physiological and psychological factors, while homeostasis is a stable flow rather than static state. The internal environment emphasizes the fluidity of change within a space, individual's body to sustain its well-being with the vast changes which encroach upon it from the environment. The external environment is divided into the perceptual, operational, and conceptual environments. The perceptual environment is an aspect of the world that individual is able to intercept. Operational environment is the elements that may physically affect individuals but not perceived by radiation, microorganism, and pollution. Conceptual environment is a part of person's environment including cultural patterns characterized by spiritual existence, ideas, values, beliefs, and tradition. Health and disease. These are patterns of adaptive change. Health is implied to mean unity and integrity, and is wholeness and successful adaptation. The goal of nursing is to promote health. It is not merely the healing of an afflicted part, it is rather the return to selfhood, where the encroachment of the disability can be set aside entirely, and the individual is free to pursue once more his or her own interests without constraint. On the other hand, disease is unregulated and undisciplined change and must be stopped or death will ensue. Nursing. It involves engaging in human interaction designed to promote wholeness through adaptation. The individual's integrity is nurse abiding concern, and it is the nurse's responsibility to assist the patient to defend and to seek its realization. Use of empirical evidence. Levine based much of her work on accepted scientific principles that were well researched. She believed that specific nursing activities could be deduced from scientific principles. The major assumptions on Levine's conservation model. The nurse creates an environment in which healing can occur. A human being is more than the sum of his parts. Human beings respond in a predictive way. Human beings are unique in their responses. Human beings know and appraise objects, conditions, and situations. Human beings sense, reflect, reason, and understand. Human beings' actions are self-determined even when emotional. Human beings are capable of prolonging reflection through such as asking questions. For more information about Levine's conservation model, let's hear some of it from Ms. Tanudra's report.
Now let us proceed to theoretical assertions. The four major assertions are: nursing intervention is based on the conservation of the individual patient's energy. Nursing intervention is based on the conservation of the individual patient's structural integrity. Nursing intervention is based on the conservation of the individual patient's personal integrity. And the last one, nursing intervention is based on the conservation of the individual patient's social integrity. Theoretical assertions. Levine provided some thoughts about the two theories in their early stage of development. The first theory is the theory of therapeutic intention. It is intended to provide the basis of nursing intervention that focus in the biological realities of the patient. And the second theory is the theory of redundancy. Expands the redundancy domain of adaptation and offers explanations for redundant options, such as those found in aging and the physiological adaptations of a failing heart. Logical form. Levine primarily uses deductive logic. She integrates theories and concepts from humanities and the sciences for nursing, physiology, psychology, and sociology. She uses the information to analyze the nursing practice. With the assistance of many of her students and colleagues, and through her own personal health encounters, she experiences the conservation model in its principles operating in process. Acceptance by the nursing community. In practice, Levine's model has been applied to nursing practice with many types of patients, such as neonates, children, women in labor, patients with cancer, patients with neurological dysfunction, and many more. In education, Levine wrote her textbook, Introduction to Clinical Nursing, as an organizational structure for teaching medical, surgical nursing to beginning students. It included an early discussion of death and dying. And in research, many researchers have used the conservation principles as a framework to guide research in wide-ranging clinical situations. Critique in Levine's conservation model. Clarity. The model has numerous terms. However, Levine adequately defines them for clarity. Simplicity. Although the four conservation principles appear simple initially, they contain sub-concepts and multiple variables. This model is one of the simpler ones to understand. Generality. The four conservative principles can be used in all nursing contexts. Empirical evidence or the accessibility. Levine used deductive logic to develop her model, which has been used to generate research questions. Importance. Conservation model is recognized as one of the earliest nursing models to organize and clarify elements of patients' care for nursing practice. Levine's nursing process using critical thinking. Assessment. Collection of provocative facts through observation and interview of challenges to the internal and external environment using the four conservation principles. Nurses observe patients for organismic responses to illness, read medical reports, talk to patient and family. The last one, assess factors which challenge the individual. Judgment traffic cognosis. Nursing diagnosis gives meaning to provocative facts. A nursing care judgment arrived at through the use of the scientific process. Judgment is made about patients' needs for assistance. Hypothesis. This includes the planning, and the nurse proposes hypotheses about the problems and the solutions, which becomes the plan of care. And the goal is to maintain wholeness and to promote adaptation. Another Levine's nursing process using critical thinking is the interventions. This includes testing the hypothesis. Interventions are designed based on the conservative principles. It is mutually acceptable, and the goal is to maintain wholeness and to promote adaptation, just like in the hypothesis. Evaluation. Observation of organismic response to interventions. It assesses whether hypothesis is supported or not supported. If it not supported, plan is revised. New hypothesis is proposed. Application of Levine's conservation model. The case of history of Mrs. Catriona R. So the first one, the application, is the challenges or the assessment. So here you're going to ask the patient or Mrs. Catriona R if how's her feeling, or interview her family and read her medical reports. Also, you're going to observe her using the four conservation principles, which are the energy conservation, structural integrity, personal integrity, and social integrity. The second application is the judgment. So here, after you gather the information needed for diagnosis, as a nurse, you have to create a judgment for your patient's needs for assistance. The third application is the hypothesis or the interventions. So here you are testing the hypothesis, and the goal is to maintain wholeness and to promote adaptation. In other words, you are treating here the patient, like giving her medicines and giving her medical assistance needed by the patient. The last one is the evaluation. So here you are going to evaluate or observe if the patient is responding according to your plan. If not, you are going to revise the hypothesis that you proposed. Thank you for listening, and that's all for Myra Estrin Levine's conservation model.
Hildegard Peplau's theory of interpersonal relations. Hildegard Peplau was born in Reading, Pennsylvania in 1909. She died in March 17, 1999 at the age of 90 years old. She became known to many as Mother of Psychiatric Nursing and Nurse of the Century. Hildegard Peplau graduated from a diploma program in Pottstown, Pennsylvania in 1931. She earned Bachelor of Arts in Interpersonal Psychology from Bennington College in 1947, and at the same year, she finished Masters of Arts in Psychiatric Nursing from Columbia University, New York. She achieved EDD in Curriculum Development in 1953. She has been Professor Emeritus from Rutgers University. Hildegard Peplau started first post-baccalaureate program in nursing. She published Interpersonal Relations in Nursing in 1952. In 1968, she introduced interpersonal techniques, the crux of psychiatric nursing. She worked as Executive Director and President of American Nurses Association. She worked with World Health Organization and National Institute of Mental Health and Nurse Corps. The overview of Peplau's theory of interpersonal relations. According to Peplau's theory of interpersonal relations, the three sequential phases in the interpersonal nurse-to-patient relationship are as follows. First is the orientation phase. It is a problem-defining phase that starts when client meets nurse as a stranger, for the nurse to be able to define the problem and decide on the type of service needed. It is where nurse responds, explains roles to client, helps to identify problems and to use available resources and services. During this phase, individual has a felt need and seeks professional assistance. The nurse helps the individual to recognize and understand his or her problem and determine the need for help. Second is the working phase. There are two phases under it, and the first one is the identification phase. It is the selection of appropriate professional assistance, where the patient begins to have a feeling of belonging and a capability of dealing with the problem, which decreases the feeling of helplessness and hopelessness. The patient identifies with those who can help him or her, and the nurse permits exploration of feelings by the patient in undergoing illness. The identification phase is the development of a nursing care plan based on the patient's situation and goals. The second phase is exploitation phase. It is the use of professional assistance for problem-solving alternatives. The advantage of service are used and based on the needs and interests of the patients. During this phase, the individual feels as an integral part of the helping environment. The individual may make minor requests or attention-getting techniques. The patient may fluctuate on independence, so the nurse must be aware about the various phases of communication. The last is the resolution phase. It is the termination of professional relationship where the patient's needs have already been met by the collaborative effort of patient and nurse. Now they need to terminate their therapeutic relationship and dissolve the links between them. Sometimes may be difficult for both as psychological dependence persists. Patient drifts away and breaks bond with nurse, and healthier emotional behavior is demonstrated and both become mature individuals. The patient gradually puts aside old goals and adopts new goals. In capsule, orientation is where it all begins. As nurse and patient come together as strangers, meeting initiated by patient who expresses a felt need, work together to recognize, clarify, and define facts related to the need. In identification, patient participates in goal setting, has feeling of belongingness, and selectively responds to those who can meet his or her needs. In the exploitation phase, the patient actively seeks and draws knowledge and expertise of those who can help them. The resolution phase occurs after other phases are completed successfully. Roles of the nurses in the nurse-to-patient interpersonal relationship are as follows. Nurses act as a stranger, wherein they receive the client in the same way one meets a stranger in other life situation. Nurses should provide an accepting climate that builds trust. Nurses act as a teacher, who imparts knowledge reference to a need or interest. Nurses act as a resource person. They are the one who provides a specific needed information that aids in the understanding of a problem or a new situation. Nurses act as a counselor. They help to understand and integrate the meaning of current life circumstances, provides guidance and encouragement to make changes. Nurses act as a surrogate. They help to clarify domains of dependence, interdependence, and independence, and act on clients' behalf as an advocate. Nurses act as a leader. They help client assume maximum responsibility for meeting treatment goals in a mutually satisfying way.
For the next part of the discussion, we will compare the nursing process and the four phases in interpersonal theory of Hildegard Peplau. As you can see at the columns, in the first column we have the nursing process such as assessment, nursing diagnosis and planning, implementation, and evaluation. On the other hand, on the second column, we have the orientation, identification, exploitation, and resolution. For the assessment, the data collection and analysis is usually in continuous manner. May not be a felt need in the patient's perspective because it is usually initiated by the nurse. In the nursing or diagnosis and planning phase, both the patient and the nurse collaborate and communicate to mutually set goals. In the implementation, plans were initiated towards achievement of mutually set goals. And lastly is in the evaluation phase, it is usually done based on mutually expected behaviors, may lead to termination and initiation of two plans. It depends sa kung ano yung pagkasunduan ng nurse and patient sa paghiiwalay na nila. So for the interpersonal theory, in the first phase, we have the orientation. It is non-continuous data collection. Has a felt need, the patient seeks professional assistance, and so the nurse helps him or her to recognize and understand the problem and define or determine the need for help. In the identification phase, there is an interdependence or mutual dependence between the patient and the nurse in a goal setting. For the next is exploitation. It is usually patient initiated. Compared to implementation, it depends. It can be achieved by the nurse, the patient, or the family. Depende kung ano yung napag-usapan nila na sino yung gagawa ng nung napagplanuhan nila. Hindi lang yan nung patient at saka nung nurse. May kasali rin ng ang family. Depende lang. So, in identification, in exploitation rather, it is patient initiated. Patient actively seeking and drawing help. The patient fully exploits the offered services, ask for assistance, express any concern or need. And lastly is the resolution. It leads to termination. The professional relationship between the patient and the nurse ends. The patient is no more dependent on the services and the nurse and also the nurse, although some of them might still have a strong psychological connection to one another. In general, both are sequential and focus on therapeutic relationship. They use observation, communication, and recording as basic tools utilized by nursing. And lastly, both use problem-solving techniques for the nurse and patient to collaborate with the purpose of meeting the patient needs. Next is the theoretical assertions of Hildegard Peplau on the four meta-paradigms of nursing practice. Person, a developed organism that tries to reduce anxiety caused by needs. In other words, Peplau defines a person, client, or a man as an organism that strives its own ways to reduce or lessen the tension generated by needs. Health is a word symbol that implies forward movement of personality and other ongoing human processes in the direction of creative, constructive, productive, personal, and community living. Environment is an existing forces outside the organisms and in the context of culture. Although Peplau does not directly address environment, she does encourage the nurse to consider the patient's culture and mores when the patient tries to adjust to the hospital routine. Lastly is nursing. Nursing is a significant therapeutic interpersonal process according to Hildegard Peplau. It is therapeutic because Peplau consider it as a healing art that provides assistance to individual who is sick or in need. It functions cooperatively with other human processes that makes health possible for individuals in communities. Lastly is the application of Peplau's theory of interpersonal relations on the case of Mrs. Daniela. Mrs. Daniela is a 35-year-old female who came to the hospital with complaints of severe low back pain. According to her, she had been moving several pieces of furniture in their living room when suddenly she heard a click from her back. It was followed by a very severe pain So she claims that the pain is worse while standing and relief when rest and lying down. She is seeking medical help to relieve her pain, improve her ability, and to be able to perform her normal activities in daily lives, including her job as an elementary grade school. She wants to know if she injured her back and what will be the consequences of her condition. She expressed her willingness to cooperate with any prescribed diagnostic procedures, treatments, and therapy. So after undergoing physical examinations, myelography, and MRI, she was diagnosed to have herniated nucleus pulposus or a slip disc in the lumbar 4 and 5. So Nurse John Paul, the nurse who was assigned to take care of Mrs. Daniela, has decided to apply Peplau's theory of interpersonal relation. So after applying the theory, it can be observed or concluded that during orientation phase, there is a connection or communication between Nurse Paul and Mrs. Daniela. Why? Because although they are completely strangers to one another, Mrs. Daniela still initially reluctant to talk to the nurse regarding her condition due to pain. And so, because of this, Nurse Paul was able to diagnose and orient her regarding her conditions. And so eventually, they have built a nurse-patient relationship. In working phase, Mrs. Daniela has shown the willingness to participate and be independent with the nurse, as she expresses the need for measures to get relief from pain, the need for improving her mobility, and the need to know more about the prognosis, discharge, home care, and follow-ups regarding her conditions. In exploitation phase, Mrs. Daniela really exploits the service as she cooperates and participates actively in performing exercises that will help her condition. And lastly, in the termination or the resolution phase, the client or patient expresses that the pain has reduced a lot and she is able to tolerate it now. So she has agreed to continue the exercises at home, and she also expressed that she would come for regular follow-up after discharge.
Orlando was a first-generation Irish American. She was born on August 12, 1926 in New Jersey, but her family moved to King County, New York. She was married to Robert Pelletier, and they lived in Boston area. Now, on to her nursing career. She got her nursing diploma from St. John's University in New York and her MA Mental Health Nursing from Columbia University, also in New York. She was an associate professor at Yale School of Nursing, where she was also the director of graduate program in mental health psychiatric nursing. While she was at Yale, she was a project investigator of National Institute of Mental Health grant entitled Integration of Mental Health Concepts in Basic Nursing Curriculum. From this research, she developed her nursing theory, which was published in her 1961 book named The Dynamic Nurse-Patient Relationship. Her theory was further developed at McLean Hospital in Belmont, as she was the MA director of a research project, 2 systems of nursing in a psychiatric hospital. The results of the research are contained in her 1972 book titled The Discipline and Teaching of Nursing Processes. Orlando's theory was developed in the late 1950s from observations she recorded between a nurse and a patient. Despite her efforts, she was only able to categorize the records as good or bad nursing. She then realized or understood both the formulations for good and bad nursing contained in the records. From these observations, she formulated the deliberative nursing process. Now moving on to the overview to Orlando's nursing process theory, which comes in 5. The first one being the personal nursing function, the organizing principle. This organizing principle is a response of nurses to patients' sense of helplessness, stress, or from physical limitations. At responsibility ng nurses is to fulfill the patient's needs by either supplying it directly or calling in services of others. At kung the patient's needs is fulfilled, then the nursing process is also fulfilled. Second, the patient presenting behavior, problematic situation. Before administering immediate help, the nurse must first recognize the situation as problematic. A nurse must have a mindset that any presenting behavior of patients can be a form of plea or cry for help. Kaya, the nurse-patient relationship is a dynamic whole. Ang behavior or actions ng patients ang mag-stimulate ng reactions ng nurses. Third, immediate reaction, internal response. The problematic situation in the form of the patient's presenting behavior triggers an automatic immediate reaction in the nurse that is both cognitive and affective. Any person's process of actions have four distinct items. Una, perceiving with the sense of organs, tapos ma-stimulate ang automatic thought na masusundan ng stimulation ng automatic feeling, then the action. While nurses are just like any person, except ang maaari lang makita ay ang actions, never the four interaction. Or to put it much simpler, the internal response ay ang automatic response ng nurses sa patient's behavior in both intellectual and feelings aspect. Deliberative nursing process, reflective inquiry. The deliberative nursing process views the nurse-patient situation as a dynamic whole. The nurse's behavior affects the patient's and the nurse is affected by the patient's behavior. Para maging successful ang deliberative process, there must be a shared communication between the nurse and the patient. Kung ano ang nakikita ng nurse sa pasyente and what the nurse feels and thinks about that perception must be verbally expressed o dapat niya i-share sa patient for it to be asked about. And according to Orlando, a nurse does not assume about the patient. He or she should check the validity with the patient for the reason that mas magiging effective yung immediate help ng nurses kung na-understand niya ang meaning ng kanyang perception sa patient. Madaling salita, the patient-nurse situation really does go both ways or it is really a dynamic whole kasi kailangan ng patient is immediate help while the nurse needs to fulfill that immediate help. But before the nurse fulfills that immediate help, he needs to validate if ang kanyang understanding ng needs ng patient is correct. Fifth, and lastly, improvement resolution. When the situation becomes clear, it loses its problematic character and a new equilibrium is established. When a patient's immediate need for help have been determined and met, there is improvement. If the patient's behavior has not changed, the function of nursing has not been met and the nurse continues with the inquiry process until there is the improvement. This just means that if na-fulfill na ng nurse ang immediate need ng patient, mawawala na yung existence ng problematic situation. At kung hindi pa nawawala yung existence ng problematic situation, this means that the nurse did not successfully fulfill the patient's immediate needs. Meaning, kailangan niya pang improve yung kanyang process. And according to Orlando, it's not the nurse's activity that is being evaluated, it is the result. What matters is kung na-fulfill mo ba yung needs ng patients o hindi. As a summary to this overview to Orlando's nursing process theory, we just need to remember the 5 steps. First, the organizing principle, which indicates that it's the nurse's responsibility to meet the patient's immediate needs. Second, the problematic situation. The nurse first needs to recognize the situation as problematic. Third, the internal response, which is the immediate reaction or the automatic immediate reaction of a nurse that is both cognitive and affective. Fourth, the reflective inquiry, which just states that nurse-patient situation is a dynamic whole. A nurse must verbally express his perception to the patient to validate if his perception is right. Fifth, the resolution, it just refers if the nurse's inquiry process has been successful or not, if the problematic situation has been lifted or not. Now on to the major assumptions. First point, when the patients cannot cope with their needs without help, they become distressed with feelings of helplessness. Like how retired or older people have a higher chance of depression. Kasi feeling nila, if they can't do their day-to-day routines anymore without anyone's help, they feel like wala na silang kwenta. Second point, nursing and its professional characters add to the distress of the patient. For the reason that it might be because the patient is in an irritable state and he or she sees the nurse as a factor that adds to his stress, or maybe most patients or sometimes patients just see nurses as bothersome. Third, patients are unique and individual in their responses, like how usually people say to us that we are unique. Each and every one of us is unique. Patients are also like that. They have their own pains and they have their own ways of expressing their pains and discomfort. Fourth, nursing offers mothering and nursing analogous to an adult mothering and nurturing of a child. Nursing could be compared to how a mother nurtures, cares for a child. Fifth, nursing deals with people, environment, and health. People and health are like one of the reasons or one of the main goals of nurses. People or the patients, ito yung tumatanggap ng care, ng comfort, ng help, or nurturing ng nurses. Yung health naman, ito yung joint objective ng patient at ng nurses. Environment, ito yung minamanipulate ng nurses to better help the patients into their comfort or to lessen their pains and suffering and to help them accelerate the process of healing, to accelerate the process of attaining good health again. The sixth assumption is a patient needs help in communicating needs. They are uncomfortable and ambivalent about dependency. Us as a human being, it is embarked in us that we have to be independent in our lives. We have a strong sense of self. Kaya nga nahihirapan tayo na mag-ask ng help or even acknowledge that we need help. It's because we don't want dependency or maybe we think that baka nakakaabala tayo. Next, human beings are able to be secretive or explicit about their needs, perceptions, thoughts, and feelings. Human beings are complex beings. Sometimes, they are so secretive, nahihirapan talaga tayo na express yung feelings natin, yung thought, yung emotions, or yung pains, and also sometimes we could be really clear about it. We could really voice out our feelings. Next, the nurse-patient situation is a dynamic. Actions and reactions are influenced by both nurse and patient. The nurse and patient situation, it goes both ways. It's a communication na naaapektuhan ng actions ng patient yung magiging reactions ng nurse in that situation. Next, human beings attach meanings to situations and actions that are not apparent to others. We could say, your pain or you are in a painful state right now, but in other people or in other person, it's not that painful. Parang we have our own perceptions of things. We have our own meanings of things. Next point, patients enter into nursing care through medicine. Medicine is the sole purpose of patients and why they get involved with their nursing care. Medicine and treatment is what they need, and the role of nurses is to aid and help with the treatment of patients. Next, the patient cannot state the nature and meaning of distress for his need without the nurse's help or without her first having established a helpful relationship with him. As I've said, nahihirapan ang isang tao humingi ng tulong. That's why a nurse establishes a connection with the patient first. Nurses lets the patient feel like he or she can trust them and they could help him or her. Next, any observation shared and observed with the patient is immediately useful in ascertaining and meeting his needs or finding out that he is not in need at that time. Kahit na maliit or any behaviors that the patient is showing, it's a huge help for nurses para madali nilang matulungan yung pasyente. Like any small behavioral change could be a huge help. Lastly, nurses are concerned with need that patients cannot meet on their own. Nurses are here to help or aid, kaya ang concern lang nila ay yung mga bagay na the patient needs, and if it's visible that the patient is off without any need for help, then the nurse don't need to step in.
Critical thinking in nursing practice with Orlando's theory. Assessing a patient by using Orlando's theory to guide the nursing process. Number 1, guiding principle. Finding out in meeting the patient's immediate need for help. Dito sa number 1, sinasabi na yung focus ni nurse dapat is andun lang sa patient. Dapat yung mind niya is free from distracting thoughts in order na maibigay yung tamang help kay patient based doon sa pinapakitang behavior niya, verbally and non-verbally. According to Orlando, dapat yung nurse nakafocus lang doon sa patient rather na mag-stick siya doon sa nursing care plan niya and sa mga actions na dapat i-engage niya. Number 2, problematic situation and immediate reactions. Sa number 2, the nurse recognizes cues that a patient problem may exist before the next step in the process. So ngayon, si nurse, i-identify niya yung magiging immediate reaction niya, such as yung immediate perception, thoughts, and feelings niya. According to Orlando, to find out the immediate need for help, the nurse must first recognize the situation problematic. Number 3, inquiry problem determination. So number 3, it is about identifying the problem ng patient from the word inquiry or inquiring, meaning you are collecting informations na makaka-determine sa problem ni patient. And in inquiring, it involves asking or having a conversation with the patient. And dapat kung pag makikipag-usap ka sa patient, gagamit ka ng terms na maiintindihan niya. As the problem is identified, the nurse asks the patient to confirm or refute its accuracy. Example, you perceive that patient is uncomfortable and ngayon tatanungin mo ngayon siya kung in pain ba siya. And if the patient disagrees, yung nurse i-explore niya ngayon and determine yung basis ng disagreement ni patient. Number 4, identifying specific plans for each problem. With the patient, the nurse determines actions needed and develops plan for each problem. Of course, yung every problem and needs ni patient is unique, kaya kailangan ng nursing care plan. Dito sa number 4, dito ka na bubuo ng nursing care plan after mo ma-identify and determine yung problem ni patient. After mo makagawa ng plan, i-explore mo if the patient agrees with or refutes the plan. Effective ba sa kanya? Nakatulong ba yun sa kanya para mawala yung distress and problem niya? If not, the nurse continues na the inquiry for the basis ng disagreement ni patient. So mamaya meron tayong example para dyan. Number 5 is implement. So number 5 is it is about implementing the nursing care plan. If the patient is unable, the nurse yung mag-implement ng plan, and after that, tatanungin or you-observe niya si patient if yung plan or action is nakatulong ba sa kanya. Na-meet ba niya yung needs ni patient? If not, again, the nurse explores the basis. The nurse helps the patient if he or she is unable to do it alone and explores whether the patient was helped. Pag nakuha na yung result, from that, mag-i-inquire na naman si nurse. Number 6 is improvement. Sa improvement, dito mo ino-observe yung response ni patient dun sa nursing care plan na nagawa mo. Nagkaroon ba ng improvement sa situation ni patient? The nurse asks kung yung action ba ay nakatulong kay patient, and also i-observe niya yung behavior ni patient verbally and non-verbally. If not, yung nurse patuloy niya pa rin gagamitin yung content of immediate reaction to explore with the patient hanggang sa ma-achieve yung positive change. So malalaman mo lang na may improvement sa situation ni patient if may positive change. According to Orlando, when the patient's immediate need for help have been determined and met, there is an improvement. Theoretical assertions. Theoretical assertions. First, person or human being. A developmental being with needs. Nursing clients are patients who are under medical care and who cannot deal with their needs or who cannot carry out medical treatment alone. Second, environment. No defined directly in Orlando's theory, but implicitly in the immediate context for the patient. Third, health. A sense of adequacy or well-being, fulfilled needs or sense of comfort. Lastly, nursing is a dynamic nurse-patient relationship. So dynamic means the actions and reactions are influenced by both the nurse and the patient. Nursing is responsive to individuals who suffer or anticipate a sense of helplessness. The goal of nursing is increased sense of well-being, increased inability, adequacy, and better care of self and improvement in patient's behavior. Nursing therapeutic composed of the following. First, direct function. A process of helping the patient express the specific meaning of his behavior so that his distress may be relieved. Next, indirect function. Calling for help of others, whatever help the patient may require for his need to be met. Letter C, disciplined and professional activities. Automatic activities plus matching of verbal and non-verbal responses, validation of perception, matching of thoughts and feelings with action. Lastly, automatic activities, perception by 5 senses, automatic thoughts, automatic feeling, and automatic action. Application of Orlando's nursing process theory. Case history of ACE-A. Nursing care of ACE-A with Ida Chin Orlando's nursing process discipline. So, ito yung example kung paano in-apply yung theory ni Orlando in nursing. So, quick overview lang sa case ni ACE-A. So, ACE-A is an 18-year-old college sophomore admitted to the hospital due to severe abdominal pain. Nag-undergo na siya ng exploratory abdominal surgery that involves splenectomy. Sa first post-operative day niya, sinabi niyang prefer and comfortable siya sa room na may temperature not greater than 75 degrees Fahrenheit. Stable ang vital signs niya and naka-receive na rin siya ng pain medication and muscle relaxant. Ang assigner sa kanya is si Nurse Jade. So first is the patient's behavior. Ace keeps tossing in his bed and he is also moaning. Previously, he was sleeping. So notice na nagkaroon ng change sa behavior ni patient. Second is yung nurse reaction. From that observation, Nurse Jade perceived that he is now restless and gipredict niya na baka in pain si Ace. So ngayon, mag-inquire si Nurse Jade by asking si patient. Tinanong niya if kailangan niya ng pain medication. And note that the patient can respond verbally or non-verbally. Pero sinagot ni Ace na no, gusto niya lang mag-rest, meaning the patient refutes the accuracy. So si Nurse Jade, she will continue to inquire for the basis. At this time, Nurse Jade perceives that the room temperature is warm. So na-feel niya na yung room temperature is medyo mainit. So she validated it by asking si Ace and he nodded yes, meaning hindi makatulog and uncomfortable si Ace due to warm temperature. And Nurse Jade also noted that Ace is perspiring. She also verified na yung most recent dose of pain medication na binigyan niya kay Ace is still effective. Meaning, yung problem is hindi dahil sa pain, dahil doon sa warm temperature. Then, next is the nurse action. After determining the problem, dito na papasok yung action. So, Nurse Jade adjusts the room temperature into 79 degrees Fahrenheit and also pinilitan niya yung hospital gown and bedsheets ni Ace dahil nabasa due to perspiration. So, within 30 minutes of these deliberative nursing actions, Nurse Jade evaluated that Ace is once again resting quietly, thus validating the actions were effective. In summarization, Orlando's nursing process discipline theory involves a sequence of interchanges involving patient behavior and nurse reaction that takes place until the patient's need for help as he perceived clarified. So sa theory ni Orlando, the nurse follows the standard nursing process such as yung assessment, diagnosis, planning, implementation, and yung evaluation. Sa assessment stage, dito ina-assist ng nurse holistically yung needs ni patient. Then next is yung diagnosis stage, which is ginagamit na dito yung nurse's clinical judgment about doon sa health problems. Third is yung planning. So sa stage na to, dito binubuo or ginagawa yung nursing care plan after mo ma-identify yung problem ni patient during diagnosis stage. And fourth, yung implementation stage. Dito na ini-implement yung nagawang nursing care plan. And lastly, yung evaluation stage, wherein the nurse looks for the process ni patient towards doon sa goal set ng nursing care plan. So, pag may bagong problems na na-identify, the whole process will start again. Ito yung tinuturo ng theory ni Orlando sa nursing, which is yung theory of deliberative nursing process. Sinasabi niya na nurses should act deliberatively rather than automatically. In this way, a nurse will have meaning behind the action and maibibigay niya yung tamang care kay patient at that time. According to Orlando, nursing care has to be flexible, and this theory helps nurses to focus on the patient rather than sticking dun sa nursing care plan. She stated that a deliberative nursing process has elements of continuous reflection as the nurse tries to understand the meaning to the patient of the behavior she observes and what he needs from her in order to be helped. Responses comprising this process are stimulated by the nurse's unfolding awareness of the particulars of the individual situation. So that is the end of Orlando's theory of deliberative nursing process, and thank you for listening.
Now let's talk about Joyce Travelby and Travelby's human-to-human relationship model of nursing. Travelby was born in 1926 and was known for her work as nursing tourist. She died in 1973 at the age of 47. In 1956, she earned her Bachelor of Science in Nursing degree from Louisiana State University. She was given a Master of Science in Nursing degree in 1959 from Yale University. Her career, she focuses on psychiatric nursing and education, and worked as a psychiatric nursing instructor at Orleans, Louisiana. Some of her work include Travelby's intervention in psychiatric nursing, a one-to-one relationship, interpersonal aspect of nursing, and intervention in psychiatric nursing process in the one-to-one relationship. Overview of Travelby's human-to-human relationship model of nursing. Nursing. She defined it as an interpersonal process because it is always concerned with people, either directly or indirectly. It is a role of a nurse to assist the ill person or whoever that needs an assistance or help to experience hope in order to cope with the stress of illness and suffering. Health. She divided it into two different criteria. the subjective and objective health. Travel B defines subjective health as an individually defined state of well-being in accord with self-appraisal of the physical, emotional, and spiritual status, or it is based on how a person feels. Objective health. It is based on tests and observation by a medical professional. What is human-to-human relationship? It refers to the experiences or encounter of the nurse to the ill person or someone who needs service and help of the nurse. Human being. It is a unique, irreplaceable individual, a one-time being in this world. It is also a biological organism affected, influenced, and changed by hereditary, environment, culture, and experiences. It is also a creature of contradictions, continually confronted by choices and conflict. A human being is a thinking organism capable of rational and logical thinking. Human being is an individual who knows that one day he will die. Uniqueness of human being. We are born unique, and we live our life in our own different way. The commonalities of human experiences. As mentioned, we are all unique, but we also have shared similarities, which refers to the life experiences. We may be different, but we sometimes experience the experiences of others. Patient. Travel B defined patient as someone who seek or need help, care, and assistance from the other person or human being.
Next on the overview of Travel B's human-to-human relationship model of nursing is suffering. The nature of suffering. Every human being suffers because he is a human being, and suffering is an intrinsic aspect of human condition. Definition of suffering. Suffering is a feeling of displeasure which ranges from simple transitory mental, physical, or spiritual discomfort to extreme anguish, and to those phases beyond anguish, namely the magellan phase of despair, or not caring, and the terminal phase of apathetic indifference. So it is said that suffering is a natural feeling of human being, or it is part of the life of a human. There are two types of phases in despair. First is the magellan phase, or despairful not caring. Experience when the individual has suffered mentally, physically, or spiritual too intensely over too long period of time without assistance and without decrease of suffering. Next is the terminal phase, or apathetic indifference. Occurs when the individual progresses beyond the stage of despairful or not caring, such as individual does not complain, neither does he bitterly express the angry feeling of hopelessness so typical during the phase of despair. Are the causes of suffering. Suffering is experienced when the individual encounters various types of distressing difficulties. So people suffer, or a human suffers, because of some various types. First is reactions to suffering and illness. All reactions to suffering and illness are highly individualistic. These reactions are why me? Reaction, blaming, bafflement, depression, longing, self-pity, and the acceptance reaction. The stages or reactions to suffering is always or only depends on yourself and how you deal with it. We usually react on self-blaming, self-pity, and more. Next, in human-to-human relationship model of nursing is hope. Hope is a mental state characterized by the desire to gain an end or accomplish a goal combined with some degree of expectation that what is desired or sought is attainable. In other words, hope is pag-asa o pagkakaroon ng pag-asa. So there is a differentiation and characteristics of hope. First is hope is strongly related to dependence on others. Hope is future-oriented. Hope is related to choose. Hope is related to wishing. Hope is closely related to trust, and perseverance is related to courage. Next is hopelessness. Hopelessness is devoid of hope, or in other words, it is the loss of hope. The nurse's role is to assist the ill person to maintain hope and avoid hopelessness. Because hoping, or when the patient is hoping, it helps them recover or fight for their illness. The human experience of illness and suffering. The perception of illness, suffering, and pain presented or derived comments made by ill persons or family. So the human experience of illness and suffering usually or mostly depends on the perception or what are the patients or family are saying. So dito nagdedepende kung gaano ang magiging suffering ng pasyente.
Greetings of peace and prosperity to everyone. Human must experience illness and suffering because suffering can make us more resilient, better able to endure hardships. For instance, just as a muscle, in order to build up, it must endure some pain. So our emotions must endure pain in order to strengthen. Also, suffering is the inevitable consequence of living. Every human being will suffer from the moment they go through that traumatic life event called birth. Our bodies and our minds are fragile. If we're lucky enough to live a long life, we accumulate mental and physical scars and bruises. Next, the perception of illness. Suffering and pain presented are derived comments made by ill persons or families. Pain causes endless suffering, alters lives, frustrates healthcare providers, and costs untold billions of dollars. Although pain is ubiquitous to the human experience, it remains enigmatic in terms of its diagnosis, pathophysiology, natural history, and treatment. Pain, particularly in its chronic forms, challenges the biomedical model since it obscures the traditional border between mind and body, objective and subjective, real and unreal, physical and psychosocial. For instance, chronic pain is experienced not only as bodily discomfort, but also as fears about the future, work impairment, threats to family bonds and activities, and assaults on the priorities of one's daily lives. Now let's now jump into communication, which is the other concepts of travel-based human-to-human relationship model of nursing. What is communication? Communication takes place during every encounter the nurse has with the recipient of her care. It occurs when the nurse and the ill person converse with each other, as well as when each is silent. Also, effective communication between the patient and the nurse requires some skills on the part of the nurse. These skills are infrequently talked about in nursing school and even more infrequently practiced, but they are as essential as being able to maintain a sterile field, decipher lab values, or read an electrocardiogram. For instance, when communicating with the patient or family, the nurse should be mindful of how they respond to the patient or family. Every patient or family interaction is different and there is no one-size-fits-all approach that can be used. However, there are some ways that nurses can respond to patient that can show the patient that their concerns are valid and being heard. In order to develop a strong nurse-patient relationship, some of the most important factors required for good communication are the following. First one is to be yourself. Second is to be honest. Third is to be genuine. Fourth, show that you care. And last is to follow through with anything that needs to be done after your contract or contact with the patient. For instance, during your next encounter with the patient, provide the answer or the item that the patient requested, and this will help to show the patient that they are cared about. This is especially important because it shows that the nurse listened to their concerns or questions and remembered to act on them. And also, do not forget the importance of including the family in communicating with the patient. Always remember to focus your responses to the patient about what you can do versus what you are not able to do for them. Communication technique. There are two communication techniques, and these are the use of open-ended comments or questions and use of reflecting technique. The first one was the open-ended comments or questions. Open-ended questions are questions that require a participant to answer in their own words because it is a high-quality relationship between clinicians and patients that may improve health outcomes due to more open and honest communication between patients and doctor. It is also one component of developing and strengthening a close connection, which is a thoughtful relationship-centered interview. A purposeful question imbued with curiosity and compassion are a start. Here are 4 open-ended questions which may add depth to conversations with patients. First, what health concerns do you have? This question shows interest in the patient health priorities. The hope is they'll feel comfortable expressing their own goals. Second, what are you most worried could be wrong? This gets us the patient's real underlying concerns beyond arriving at an accurate diagnosis. Full reassurance requires addressing these worries. Third, what's life been like for you during the pandemic? Asking about pandemic experience can reveal the patient challenges during the pandemic and may help you address their concerns. Lastly, can you tell me more? This simple prompt demonstrates sincere interest in a patient's story.
Hi everyone! At this moment, I will discuss to you the major causes of communication breakdown and distortion. But before that, let's define first what is communication breakdown. Okay, when we say communication breakdown, it is the failure to communicate. Kailan ito nangyayari, yung communication breakdown? It occurs when a message is not received or when a message is misinterpreted or misunderstood. In order for communication to take place, there must be a sender and a recipient. The sender, the one who will send the message, and the recipient is the one who will receive the message. And the message must be understood by all concerned. So, bakit nagkakaroon ng mga misinterpretations or misunderstanding, misconceptions of message sa communication? It's because of the different factors, the different barriers that affect the communication or that hinders or interrupt the communication. Communication breakdown can also occur when one participant in the interaction receives and correctly interprets the message, but for some reason does not wish the other person to know that the message has been understood. Not wishing to communicate or a lack of good intention can effectively block communication. In other instances, communication is blocked when one participant in an interaction responds automatically without deliberation, and this hinders or blocks the other participant from expressing himself, since this lack of deliberation gives the impression of lack of interest or of ignorance. So this time, let's proceed with the major causes of communication breakdown and distortion. First, the failure to perceive the ill person as a human being. We know that as a human being, we are all unique in our own way. We are different in terms of characteristics, abilities, and capabilities. So the failure to perceive the ill person as a human being, it is usually due to the nurse's stereotypes and preconceptions about the ill person. Kapag sinasabi natin stereotype, it is a fixed idea that many people have about a thing or a group that may be often be untrue or only partly true. Ito yung mga standardized mental picture representing an oversimplified opinion or uncritical judgment. Kapag sinasabi din naman natin preconception, it is a conception or opinion previously formed. So, bakit nagkakaroon ng stereotypes and preconceptions? It is when the nurses develop inferences and opinions about the behavior of a small group of ill persons, then generalize these beliefs until all persons in particular groups are considered to be alike. So, example of the preconceptions and stereotype. This is particularly gender stereotype. Okay, all males are cooperative when ill. So, lahat ba ng mga lalaki cooperative kapag nagkakasakit? Di ba? Hindi naman lahat ng mga lalaki cooperative. Meron din namang mga hindi cooperative kapag nagkakasakit. All females are demanding when ill. Lahat ba ng mga babae demanding kapag nagkakasakit? Hindi naman lahat. Meron din namang hindi demanding. So, yung mga preconceptions and stereotypes interfere with a nurse's ability to communicate and establish relatedness. They are the mindsets which hinder the nurse from responding and appreciating the uniqueness of others. Second, the failure to recognize levels of meaning in communication. That messages transmitted during the communication process may have meanings other than the apparent obvious literal meaning. Communication is also blocked when nurses accept statements made by ill person at face value with no reflection or thought, or when the nurses answer questions too quickly without exploring the ill person's meaning and intentions. So it is important to ascertain what ill person really mean when they ask question or make comments. Just like, for example, an ill person asked the nurse, "When am I going home?" So it is just a simple question, but this particular question have lots of meaning. So it can be the patient might want to know the day and hour of his discharge from the hospital, or gusto lang ni patient malaman if nasignan na ba ng kanyang doktor ang discharge slip, or he might be inquiring if the nurse knows that he has been discharged by his doctor. So that particular question have different meaning. So the duty of a nurse or the task of the nurse in such
a situation is to elicit from the individual his reason for asking the question. The third one would be the failure to listen. So failure to listen is the major cause of communication breakdown. So the nurse may not be willing to expend the necessary energy kasi yung mga nurses, pagod din yan sila sa trabaho nila. And sometimes they are also preoccupied and bored or disinterested. So the nurses may fail to listen because of the manner in which the ill person speaks. So, example, yung patient ay mahina ang boses so hindi siya marinig or displays other speech habits which trend to encourage not listening. So failure to listen to ill person also may be caused by the nurse talking too much and interrupting the individual when he is conversing. So it is a cardinal rule for nurses to follow in interacting with ill persons. So dapat natin tong tandaan as a future nurses dealing with our future patients. Never assume that an ill person likes to talk as much or as little as you do. Instead, strive to adjust to the ill person's tempo and pace in conversation. So, dapat ang nurses ang mag-adjust para sa patient. Kasi si patient, may sakit si patient, may iniinda. So, meaning, minsan ang mga patient kapag may sakit, irritable or hindi sila comfortable. So, yung mga nurses ang mag-adjust para sa patient. Okay, the fourth one would be using value statements without reflection. A nurse uses value statements when she responds to an ill person's comment by using such statement, just like, for example, isn't that fortunate or fine or wonderful, and etc., before discovering how the ill person feels about the situation in question. So, dito napapasok yung pagiging sensitive natin sa patient natin. So, as a future nurses. Just like, for example, an individual tells the nurse that he is going home tomorrow, and the nurse responds by saying, isn't that wonderful? Unless it is obvious that the individual is pleased, it is suggested that the nurse first elicit from the ill person how he feels about going home instead of operating an assumption that all ill persons feel wonderful about going home. The statement I'm going home tomorrow may have been initiated by ill person for any number of reasons. One of which may be that the ill person is worried about caring for himself at home kasi kapag umuwi na siya, walang mag-aalaga sa kanya. Wala ng mga nurses, wala ng doktor na mag-monitor sa kanyang health. No? So, he maybe feel worried about that one. So the nurse's response blocks further exploration, and unless the individual is unusually persistent and explains his problems to the nurse, he will probably not allude to it again since he realized that the nurse cannot or will not assist him in this matter. The fifth one, the cliches and automatic responses. The use of cliches and automatic responses hinders and blocks communications. When you say cliche, it is a tried, tired, meaningless, and hackneyed phrase or questions. It is usually automatically used without reflection or thought on the part of the nurse. It also includes pat answers and stock replies. Just for example, an individual scheduled for surgery says to the nurse, I am a little worried about the operation. Typical cliche-like responses on the part of the nurse may be, example, don't worry, you have a good doctor, or you'll be alright, or I'm sure everything will just be fine. In this example, the nurse does not allow the ill person to explore the nature of his concern, and since she does not know what the problem is, not having discussed it, she is unable to assist the individual in resolving the difficulty. So it is the task of the professional nurse practitioner to elicit from the ill person the nature of his concern and then to plan nursing intervention accordingly. The sixth one, accusing, blaming, and teasing. Another effective means of blocking communication is to accuse, blame, or tease ill persons. Some nurses blame ill persons and verbally accuse them of accusing their own illness or injury. The ill person may be accused, taunted, teased, or in some way made to feel stupid, careless, and inadequate. An individual who knows he causes illness or injury is not helped by a nurse who accuses him of having brought his condition on himself. Some nurses give the impression that they are very busy and are not about to waste time and sympathy on anyone who deliberately causes his own hospitalization. The nurse behaves as if the individual's illness or injury is a personal affront to her. Some nurses tease ill persons or attempt to induce shame in a misguided attempt to affect a change in the ill person's behavior. Just like, for example, they may tell an ill person who is crying to stop acting like a baby. The nurse may also imply that the ill person is too big or too old to behave in such a childish manner. Behaviors such as accusing, blaming, and teasing block the communication process. It is not possible for the nurses to establish relatedness with ill persons when they use these kinds of tactics. And the last one would be the failure to interrupt. Another major cause of communication breakdown and distortion seems to stem from the nurse's belief that it is impolite to interrupt ill persons while they are speaking. Just like, for example, an ill person may talk for some period of time, may bring forth numerous and diverse ideas that require exploration. The nurse may not clearly understand what the individual means unless the nurse interrupts the individual's conversation. It is not likely that she will be able to remember, much less explore with the person the meaning of his comments. It is therefore recommended that the nurse interrupts the ill person's conversation and clarify any unclear comments. This is a guiding principle that the nurse should explore with the ill individual any comment that she does not understand.
Human-to-human relationship. The major assumption of this work is that it is a task of the professional nurse practitioner to establish a human-to-human relationship. A characteristic of the human-to-human relationship is that both nurse and ill person perceive and relate to each other as unique human beings rather than as nurse to patient. Another major assumption is that a human-to-human relationship is established after the nurse and recipients of her care have progressed through the four preceding interlocking phases. These phases are the original encounter, emerging identities, empathy, and sympathy. Phases leading to the establishment of a human-to-human relationship. Phase of the original encounter. When the nurse encounters a person for the first time, she observes and develops inferences and value judgments about the individual, as the person usually does about the nurse. Observation is the first and most important step in the nursing process. Observation and development of inferences which follows are important since they serve as a basis for decision made. Phase of emerging identities. The phase of emerging identities is characterized by the ability to appreciate the uniqueness of another person as well as the ability to establish a bond with other individual. It is getting beyond and outside of self to some extent in order to perceive another, yet using self as the instrument to accomplish this purpose. Phase of empathy. Empathy is an experience which takes place between two or more individuals. It is basically the ability to enter into or share in and comprehend the momentary psychological state of another individual. A process wherein an individual is able to see beyond outward behavior and sense another's inner experience. Phase of sympathy. The ability to sympathize emerges and results from the empathic process. It is a step beyond empathy in that in sympathy there is a basic urge or desire to alleviate distress. This desire to alleviate distress is a characteristic of sympathy. Phase of rapport. Rapport is that which experience when nurse and ill person have progressed through the four interlocking phases preceding rapport and the establishment of a human-to-human relationship. Rapport is a process, a happening, an experience, or series of experiences undergone simultaneously by the nurse and the recipient of her care. Nursing process and travel-based human-to-human relationship model of nursing. Observation. Observation is the first step leading to nursing interventions. It is also an inherent aspect of the communication process. It is possible for a nurse to be skilled observer, but it is practically impossible to communicate meaningfully and purposely without being skilled observer. Definition of observation. Observation refers to the collection of raw sensory data prior to the interpretation. To observe is to notice, be mindful of, or focus on what is happening in a situation. An active process and meaningful as well as a purposeful process. Purpose of observation. The purpose of observation may be grouped broadly as follows: to infer patient needs and problems in order to plan appropriate nursing action, to assist the physician in diagnosing the individual's illness, to access the efficacy of therapies prescribed by the physician, to gather the information about the ill person in order to share these findings with other members of the health team, to prevent implications and sequelae, and to observe signs of illness. Data collection. The data the nurse collects consists of what is seen, heard, smelled, or touched. It is important to identify and collect raw data prior to interpreting their meaning. For example, a person frowns. The raw data, wrinkling of the brows or frowning, may be interpreted as indicating pain, anger, worry, and etc. Experiencing an aspect of observation. Experiencing means focusing on the individual within the total context of his setting and environment, not part or aspects of the whole. One reacts as human to human and allows the other's personality and uniqueness to become real, on a level other than what is known about him. Decision-making and interpretation. This decision-making has tremendous implication in nursing situations. The decisions to be made is ranged from the selection of comfort measure to decisions which may mean the difference between life or death for an ill individual. Nursing actions and appraisal. Following the interpretation and decision-making, the nurse acts or intervenes. Not only are needs ascertained through the communication process, they are also met. For example, an ill person may require health teaching or may need information. The nurse appraises or judges the quality or efficacy of her nursing actions.
Good morning, everyone, and welcome to the presentation. As you can see on the screen, our topic today is Hall's core care cure theory of nursing. By the end of this talk, you will be familiar with Elijah Hall's core care cure theory and nursing processes. I am going to be talking to you about Elijah history and background. I'd like us to focus our attention in the pictures of the presentation. She is Elijah Hall. She received her basic nursing education at New York Hospital School of Nursing in Pennsylvania, 1927. In 1937, she earned her bachelor's in public health nursing, and in 1942, master's in teaching natural sciences. Let's now look at the next slide. Elijah Hall served as the first director of the Loeb Center for Nursing and Rehabilitation until her death in 1969. The Loeb Center at the Montefiore Hospital in the Bronx, New York, provided professional nursing care to the patients who had progressed beyond the acute stage of their illnesses. The candidates for Loeb Center care, mga 16 years old and older at yung mga hindi nagsasuffer ng acute biological disturbance. They were transferred mula sa isang hospital na matinding pangangalaga sa Loeb Center. And to those who wanted to come Loeb, were recommended by their doctors at dapat magkaroon ng pagkakataon na gumaling at makabalik sa kanilang communities were good candidates for care at the Loeb Center. Hall design the Loeb Center physically to have 80 capacity of bed. To Manifure Hospital, the rooms were arranged with the priority of nursing. Ang primary purpose ng Loeb ay to demonstrate highly quality nursing care given by registered nurses para to those who has illnesses and able to recover sooner. Hall died in 1969. In this part of presentation, let me give you an overview of Lydia Hall's core care cure theory of nursing. It would be useful to divide our talk into three main circles of theory of nursing: the care circle, the cure circle, and the core circle. According to the theory, nurses are focused on performing the noble task of nurturing patients. This specifically speaks to the motherly nature of nursing, which may include a nurse addressing a patient's comfort issues. The role of nursing also includes educating patients and helping a patient meet any needs he or she unable to meet alone. The nurturing component of a care and is exclusive to nursing. It involves the concept of mothering. Have you ever in a situation where ikaw ay may sakit, then your mama noticed it? I remember when I was 6 years old at naligo ako sa ulan. It turned out that nagkaroon ako ng high fever sa gabi. And she takes care of me. And that's the concept of care circle that make up concept of mothering, care and comfort someone. It provides bodily care for the patient and helping to complete such as basic daily biological functions such as eating, bathing, and dressing. Moreover, the nurse's role also includes educating patients. Di ba sabi ko sa'yo na huwag kang magpapatuyo, huwag maliligo sa ulan, huwag kang kumain ng maraming candy, baka sumakit sa bandang ngipin mo. And that's the example of mothering. When functioning in the care circle, the nurse applies knowledge of a natural biological. The nurse goal is to comfort patient. Kapag uminom ka ng gamot, gagaling ka na. Okay? Sabay thumbs up. In interaction with the patients, the nurse's role reaches a professionalism and they helps patient meet any needs. Let's now look at the next slide. The core circle. The patient to whom nursing care is directed. The core has set goals by him or herself rather than a healthcare provider or family and friends. The core makes decisions and behaves according to his or her feelings and values. According to Hall's theory, patient receiving nursing care and the core has goals set him or herself rather than by other person and behaves according to their feelings and values. In this area, it emphasizes the patient's social, emotional, spiritual, and intellectual needs. The professional nurse acts as a mirror to the patient to help the latter explore his or her own feeling regarding his or her current health. The patient is able to develop who they are, able to develop maturity when the nurse are unable to listen to him or her. And lastly, motivation are discovered through the process of bringing into awareness the feeling being experienced, and by this awareness, the patient can now make conscious decision based on understood and accepted feelings. Let's now look at the next slide. The cure circle. Attention given to the patient by the nurse and other medical professionals. In this model, the focus of care is not only on the nurse but also on the healthcare professionals involved in the care of the patient. The cure includes interventions or actions geared toward treating the patient of whatever illness, disease, or disability he or she may be suffering from. As explained in this theory, the cure is nursing. which involves the administration of medication and treatments. Halls explain in the model that nurse shares the cure circle with her health professional, such as the physicians or physical therapists. In short, this or the intervention towards treating patient for whatever illness or disease he or she is suffering from. A nurse function in all their circle but different degrees. For example, in the care phase, the nurse gives hand-on bodily care to the patient about daily living activities such as toileting and bathing. In the curing phase, the nurse applies medical knowledge to the treatment of the person. In the core phase, the nurse addresses the patient's social and emotional need for effective communication. Interaction of the three aspects of nursing. Hall emphasizes the importance of total person approach. The three aspects interact and the circles representing them. Them change size depending on the patient's total course of progress. In the philosophy of Loeb Center, the professional nurse function most therapeutically when patients have entered the second stage of their hospital stay. They are recuperating and are past an acute stage of illness. Before I move on, I'd like to recap the main points. Lydia Hall used her knowledge of psychiatry and nursing experiences in Loeb Center as a framework for formulating the care, cure, and cure theory. Her model contains three independent but interconnected circles: the core, the care, and the cure. The core is the patient itself. The cure refers to the medical and nursing intervention, and the care is the nurturing provided by nurse. Even though Hall confined her concepts for patients with the age of 16 years and above, the concept of care, cure, and cure can still be applied to every age group, but again, none was specified. This theory emphasizes the importance of the total patient rather than looking at one part or aspect. And for a nurse to successfully apply Hall's theory, the individual must pass an acute stage of illness. In this theory, no nursing contact with healthy individuals, families, or communities contradict the concept of health maintenance and disease prevention. This brings me to the end of my point.
Lydia Hall's theory and the nursing process. Hall's theory influences the nursing total approach to the 5 phases of the nursing process: the assessment, diagnosis, planning, implementation, and evaluation. For the assessment phase, it is understandable that it involves collecting of data about the health status of the individual. According to Hall, the process of data collection is directed for the benefit of the patient rather than for the benefit of the nurse. Data collection should be directed toward increasing the patient's self-awareness. So, we can gather different data from our patients by observing and reflecting kung ano ang nakikita natin para ma-assist natin ang ating mga patients na maging aware sa kanilang verbal and non-verbal behavior, because being aware of their feelings and needs greatly contribute a lot for their self-healing. And we can also collect biologic data from physical and laboratory exam in order for the patient and family to understand kung ano ang sakit at kung ano ang mga improvements ng pasyente. Next is the nursing diagnosis phase. So, a statement of the patient's need or problem area. In Hall's theory, the patient is the one who identifies the needs. So, since ang patient ang mas nakakaalam kung saan ang may sakit sa kanya, it needs their statement in order to add sa gathered information at makreate ng diagnosis sa patient para mabigyan ng solution or kahit pauna lunas. Next is the outcomes and planning. So, involve setting priorities and mutually establishing patient-centered outcomes or goal. The patient decide what is of highest priority and also what outcomes and goals are desirable. The core is involved in outcomes and planning. So for this stage, it is the nurse's role to help the patient to be aware of its needs, feelings, and motivations. And once stable na ang mentality ng pasyente, according to Hall, the best person to identify, set goals, and outcomes and arrange priorities is the patient. And as a nurse, it is our responsibility to keep the patient's goal consistent by presenting them options based in social and scientific areas with creative alternatives in order for the patient or family to choose what is the desired outcome. So next is the implementation phase. So it involves the actual institution of the plan of care. This phase is the actual giving of nursing care. So aside from giving nursing care, at the same time, tinutulungan natin ang patient na ma-achieve ang goal nito based sa chosen plan and outcome na pinili nila. So we can guide them by helping them with their emotional needs and providing information and support their patient-made decisions in order for them to understand and implement the medical plan. Lastly is the evaluation. So for this process, it is about assessing the patient's progress toward the health goal. The evaluation phase of the process is directed toward deciding whether or not the patient is successful in reaching the established goals. So, in this phase, we evaluate the improvement and foresee if ma-reach na patient ang goal nito. And there are some questions na needed to be answered in this phase for evaluation. So, next is the theoretical assertions. So, for the first is the person. So the individual human who is 16 years old or older and past the acute stage of long-term illness is the focus of nursing care in Hall's theory. So the source of energy and motivation for healing is the individual care for recipient, not the healthcare provider. So sinasabi dito na ang willpower ng isang tao ang makatulong sa kanya na gumaling siya, hindi lamang yung healthcare provider. So the individual is unique, capable of growth and learning, requiring a total person approach. So next is health, a state of self-awareness with conscious selection of behaviors that are optimal for the individual. Hall stresses the need to help the person explore the meaning of his or her behavior to identify and overcome problems through developing self-identity and maturity. So as a nurse, it is our job to teach the patients about self-awareness to identify kung ano ang dinadamdam nila. For example is, during menstruation for girls, having mood swings is normal because of our fluctuating hormone levels, but we must also need to be aware na di yan natin pwedeng maging excuse para maging sobrang masungit, or so we need to learn the reasons behind our emotional changes, in order to manage it maturely. Next is environment or society. Is dealt with in relation to the individual. Hall is credited with developing Levine-Center's concept because she assumed that the hospital environment during treatment of acute illness creates a difficult psychological experience for the ill individual. Levine-Center focuses on providing an environment that is conducive to the self-development. In such setting, the focus of the nurse's action is the individual. In any action taken concerning society or the environment are for the purpose of assisting the individual in attaining personal goal. So next is the nursing. Nursing is identified as consisting of participation in the care, core, and cure aspects of patient care. So a while ago, the care, core, and cure is discussed by Miss Angeline, and it is said there, or it is analyzed that care is the sole function of nurses, whereas core and cure are shared with other members of the healthcare team. The major purpose of care is to achieve an interpersonal relationship with the individual that will facilitate the individual of core. Example is the development of self-identity and self-direction by the patient. We must note that the concept of nursing is clearly identified by Hall. She does not speak directly to the other three concepts, the person, health, and environment. However, inferences can be made from her work.